Well, hello, friends. Welcome to another episode of Intentional Living with Emlah. I hope you are having a wonderful week so far. And today I am very excited because I do have my wonderful friend, Dr. Gorka, with me in the studio.
Yes. So Dr. Gorka directs the Division of Risk Resilience and Trauma and Suicide Prevention. So mark that word resilience because I'm going to talk again about it at the Ohio State University Medical Center. And I could sit here and list her qualifications all day long, but her lived experiences is what attracts me to her. Because not only does she have the academic qualification to talk about this, she has lived in grief and exposed, secondhand experience to upbringing in a family where substance abuse was commonplace and has experienced our mental health system firsthand. And so what better person is there for me to ask all the questions about mental health? Because we can write about mental health every day, resilience, and depression, anxiety, stress. But if we don't do something. So my questions to you today will be, what can we do as Ohioans?
Yeah.
So I'm very grateful that you accepted my invitation to come again to the podcast instead of, being at work or taking care of your babies. But you're back here. Thank you for coming on.
Yes. Thank you for having me. I'm excited to talk today about nature.
Yes.
And how we can support our mental health and our physical health. So I think this is really important because we often think of nature still as a luxury, sort of as recreation, but the science has really exploded over the past 2 decades about how important and fundamental nature is to supporting our overall well-being. So I'm excited to share some of this with our listeners.
Yes.
Because I think there's real low-hanging fruit there, easy strategies that we can incorporate in our day-to-day life that hopefully aren't too overwhelming.
Yes, we don't want overwhelming.
Yes.
Like I want to know what sparked this idea in you. What came to your mind? You're doing a lot of research on suicide prevention, mental health, and all this stuff. What came to your mind on nature?
Yes.
What happened?
So for part of my work, we have been running a study called the State of Ohio Adversity and Resilience Project. And this is funded through the state of Ohio.
Yes.
And we have surveyed 16,000 Ohioans over the past 2 years in all 88 counties of Ohio. And we have been asking them about their mental health, their physical health, their resources, and some of their backgrounds. And I have been digging deep into that data and just really trying to learn what are our risk factors, what are our resilience factors. And what we see from that data is that a lot of Ohioans are struggling with their mental health. There are high levels of loneliness, distress, feeling disconnected or defeated. So when you look at that and you look at the scale and just how many people and all of, I stare at the map of Ohio of how many people I would, hope to help and support. You really have to think outside the box and more creatively on what are we going to do? There will never be enough clinicians, therapists, not even enough chat bots, I don't think, to really help all individuals in all of these different counties. And that has led me to nature.
Oh my
and
gosh.
the science on nature and how it really supports the way we regulate stress, how our body responds to stress, how it can lower your blood pressure, your anxiety, your depression, just by looking and having contact with green space. And for me, that's something that individuals in all 88 counties of Ohio can have access to, can use as a tool for their health. So I'm drawn to it by the fact that it's inexpensive, it is accessible in a lot of ways, and it's scalable. I feel like this is something I can do to help large groups of people.
I'm still stuck on the first few sentences you made. You said this study, this study, all 88 counties in Ohio, and 16,000 people.
Right.
Children included?
Yes.
Children included.
Yeah.
So, and when you're talking about that, you were talking about Ohio, and I was extrapolating that data, and I'm like, if we take this data and take it to the United States, we're going to get similar results. If we
Yeah.
take it globally, we're going to get similar results.
Yes.
So we know already that we have a problem.
Yes.
We know that we have a problem. What are we going to do to resolve this problem? Because right now, we have our phones. We spend a lot of time with our phones. We spend a
Yes.
lot of time indoors, and we realize that we have a problem. We go to the hospital. We get a prescription from
Yeah.
our physicians, healthcare providers for our antidepressants and our anti-anxiety medications. We take them.
Right.
But yet, my tagline at the pharmacy is there's a lot more to health than prescriptions.
Yes.
So bring a little bit of explanation of
Yes.
science to it for me.
Yep.
What happens inside our brains
Yep.
when I leave? Right now, I'm in the podcast studio with you. I could be here, leave, go to the pharmacy, spend all my day indoors, 8 hours before I go home, crash on the couch.
Yeah.
What happens in my brain if I get outside when I go home and just spend 15 minutes behind the house, outside?
Yes.
What happens inside my brain?
Today, across the U.S., we spend 90% of our time indoors.
Whoa.
90%, which is remarkable. And we spend a lot of time on screens and on our phones.
I have to work.
Right.
I have to work. So that's the thing. So how can we?
Right.
90% of my time is spent indoors.
But if you think about that, is not how we evolved.
No.
For most of human history, we've lived outdoors. And there's something very important about outdoors is that it engages, when you're outside, it engages all 5 of your senses. There's sight, there's sound, there's touch, there's smell, and your brain is integrating that information. You have to look far away and then look close up. So you're really using aspects of your brain and your nervous system that are just critical. I mean, that's who we are.
I didn't think about it like that.
But when we're inside, think about how, you look and you see a wall.
Just near.
You look at a screen. There's not the sounds and the sights and the integration. And there's a term that was part of a wonderful book that was published in 2005 called nature deficient disorder. It's not an actual disorder. It's more so a term to say that there are real costs and consequences to the fact that we have moved so indoors and that we are not engaging our brain and our nervous system in the way that we were evolved to do it. It's almost like a house cat versus a wild cat. They have different skills and they engage different, senses and reflexes and instincts. And we don't sharpen that. We're dulling our senses by spending time indoors. And that trend coincides with increases in depression, anxiety, ADHD. I mean, think about the role that there is on attention regulation and stress. So another really classic study that I think just grabs people's attention is from 1984, where there was a hospital and they looked at individuals who had gallbladder surgery. And nothing was different about these patients except some had a hospital bed that looked over trees and others were in a hospital bed that looked to a brick wall. And they got all the medical information and charts from these individuals, and the results are striking. That those who overlooked trees and green space had, less complications. They required less pain medication. They discharged from the hospital earlier. And that there was nothing else different about any of these patients other than this environmental access to viewing green space.
I have read that study. So when you started saying it, I was just laughing because we talked about this earlier. And so it doesn't have to be complete immersion. You don't have to leave and go to Hocking Hills or go somewhere to go and spend time in nature. It could literally be seeing green space out of the window.
Yes. That has
as easy
less
as
of
that.
an effect than being outside.
Better than nothing.
It is absolutely, dose matters, but it really doesn't take a lot. And
my
the
goodness.
science has really shown us that consistency, a little bit
Yes.
every day, really matters so much more than one big vacation or outing every year. So, it's not that, I'm going to plan that trip to Hocking Hills and that's
Yes.
where we're going to shove all the nature in there, over a weekend. It's more about small amounts of time every
Yes.
day that would really, it goes such a long way in terms of your overall health and the way that it regulates stress and helps you regulate your emotions passively.
I'm still stuck on that study. Can you please send me a link to that study? I need to
Yeah.
put it in the show notes,
Yeah.
And so it makes such a big difference because the thing is that in our minds, we always think that it has to be big and long. I have to go spend,
Right.
1 week, in nature retreat somewhere in
Right.
order to get full benefit from it. But what you're
Right.
telling me is that it just has to be as little as 15 minutes outside every day.
Yes.
So just go out to a regular park
Yes.
around. And so there are like 4 parks around me that I can walk to from
Yeah.
my house.
Yeah.
And if I'm driving, it will be like less than 5 minutes.
Right.
So, and I could just go there and just walk around the woods.
Yeah.
And that's one of my favorite things to do.
Yes.
There is a word. When we had you on the podcast last time, we talked about resilience.
Yes.
And that is one of my favorite things that we talked about.
Yeah.
I went back and listened to that and it really touched me.
Yeah.
We're going to put a link in the show notes to the previous episode when we talked with Dr. Gorka here. And if you have not listened to that episode, please make the time to listen to it. I just want to ask you, what is resilience?
Yeah.
One more time for our people.
Yeah.
What does Dr. Gorka tell us resilience is in the simplest words possible?
Yeah, the simplest words possible is we think of resilience as your ability to tolerate and handle adversity. And perhaps stress, but to handle setbacks and to keep marching forward, to not necessarily get derailed by some of these things. And I'm so glad that you mentioned that because I think of nature as a tool for resilience because it actually, by being outside, children especially, but also adults, you're more likely to take small risks.
Yeah.
And to tolerate some uncertainty. Is there a snake over there? Can I make it over this rock? Can I, jump this way? And by doing that, that actually helps us build those muscles of being able to tolerate uncertainty, tolerate stress, get dirty. And it really does contribute to that word resilience. And we all want that, as parents. We want that. Like, how do we make our kids more resilient? How do we know life is stressful? How do we set them
Prepare
up
them.
to tolerate
Yes.
and be okay? And I think this is one thing that does fulfill that goal on building resilience.
I love that. And I think, every time I remind myself of the pillars of intentional living and really why I created this podcast, on those pillars, nutrition, movement, inner alignment, and positive social connections. These are in addition to.
Yeah.
So we talk about all these things. And, we were talking before we started recording the podcast. We were talking about something you could do that will affect all 4 pillars.
Yes.
And I was thinking to myself, while you were talking, I was just here daydreaming. And I was like, will there ever be a time when I will come to you and you write a prescription for nature for me? Like, how's that going to feel like? How is that going to feel like? Like, instead of, just giving me sertraline, or saying, hey, Emlah, I need you to spend 15 minutes outside 5 days a week.
Yep.
And hand that to me.
Yep.
And then I go and put in an effort to spend 15 minutes outside my house and outside my work in nature. So I have to go to Concord Park or I have to go somewhere and just walk at Liberty Park somewhere.
Yeah. I'm
for
working
15
on
minutes.
This. I'm working on this.
Tell me
at
more.
Ohio State.
Yeah.
We actually have a platform for this in the state of Ohio. It's called Park RX. And it is, again, supported by our state where there is a prescription that you can give to patients for time spent outside for both mental health and physical health reasons. So I saw this. I found this because of my own interests and passions. And I started asking all corners of our medical center, is anybody using Park RX? Are we
Yes.
are we prescribing nature?
Yes.
And I did not find a single person in the healthcare system that had really even heard of it,
This has to change.
let alone using it. I found some individuals in the
Yes.
community in private practice.
Mhm.
And so I'm actually doing a small little study where I'm asking people, why aren't we, what would make you more likely to use Park RX, and just better trying to understand the barriers. But in
Wow.
the own clinical programs that I help lead, we have started incorporating this as another tool to support people's recovery, their
Yes.
treatment goals. They want to feel better. They presented to a psychiatry department, like, what can I do? We're still using our evidence-based treatments. They're still getting their therapy. But if you talk about complements and supplements and
Yes.
just ways to just boost outcomes, this is one. And I want to also throw in that actually doing therapy outside has been shown to be more effective than doing therapy inside.
Oh.
And we are playing around with that as well. How do we actually bring some of our group treatments outdoors? How do we practice mindfulness meditation with our patients outdoors? And do we actually see better outcomes because there's just like that multi-pronged effect? And it looks great.
See, every time I talk with you, I just feel like I want to stop doing what we're doing right now. Like I want to stop talking on this podcast right now and get outside and just go walk in the woods.
Yes.
Like I just feel like, because that's what I need. That's what we all need.
That's what we all need.
You just feel better when you
feel
do it.
better.
So my listeners know that I love data so much.
Yes.
The scientist in me cannot hide. We love to measure inflammation levels, systemic inflammation levels, measure heart rate, measure cortisol, measure all our biomarkers, the hormones, that inner alignment piece that we can actually put a number on it. So from your work and your research, is there a possibility to measure like biomarkers and the data on the effect on our body in spending time in nature? What biomarkers are we measuring there? And tell me more about that.
I would say that the science has already shown us that nature is good for you.
Yes.
I think that part is covered.
Without
and
question.
I think it has moved now to understanding why.
Yes.
What are those factors? What are those, we call them mechanisms, that actually contribute or account for these benefits?
Yes.
So, and that's something that I am working on contributing to.
Yes.
So there's a couple of different pathways that seem to be relevant. One is through inflammation and immune signaling that has been shown to change the more contact that you have with nature, and even just nature smells. There was another amazing study where they put people in hotel rooms that were the same, and they pumped in actual oils and particles from nature into the air. And another one just had regular room air, and they saw all these immune changes in the individuals who just
Wait, Dr. Gorka, you amaze me. Is there you just come up with random articles every time? How much time do you spend reading research articles? Just side note.
I've been reading a lot of research and a lot of books in my car, like audiobooks.
Oh my gosh. This podcast is sponsored by Journeys, your path to intentional wellness. Are you feeling fatigue, brain fog, low energy levels, and suspicion of inflammation? Most health problems don't start overnight, and neither does wellness. With Journeys, you can take charge of your health before you have to. Every cell in your body is whispering to you. But when we ignore preventive medicine, we wait until those cells are screaming. Journeys helps you listen to the whispers. There are 3 different lab test bundles to choose from. Starting at $199 up to $479, we measure up to 125 biomarkers, most that are typically not measured at your annual wellness visit. Normal labs is not a diagnosis. We get the most complete view, including hormones, nutrient markers that support energy, balance, and healthy aging. Each journey includes a personalized recommendation, one-on-one care from your pharmacist, and follow-up support to turn results into lasting intentional change. It's more than data. It's guidance, accountability, and a partner in your wellness journey. Intentional living means paying attention, staying curious, and taking steps towards the health you deserve. Start your journeys today. Click the link in the show notes. That is interesting. So if I went to a hotel and then they're just like,
Yeah.
nature smells.
Yeah.
And those people felt better. Their immune system was better.
Yeah. Last Child in the Woods is an amazing book for anyone who wants to become obsessed with this like I am, especially parents. It really talks about brain development.
Yes.
And Nature Fix is another great book that really goes through the science of what does nature do. But so one is immune, one is also the microbiome.
Yes.
And the gut-brain axis. There's a lot that, touching soil, touching grass, all of that can actually get microbes, positive beneficial microbes into your body and actually change the gut-brain axis. There are cortisol findings, absolutely. Things about just like lowered blood pressure, changes in heart rate variability. And there's studies where they're walking around in a forest with an EEG cap on their head looking at brain waves. I mean, a lot of us are very invested in really trying to figure this out so that we can harness it. But other countries, I will go back to the prescriptions, are leaned into this much more than the United States and much more than the state of Ohio. In Japan, they will prescribe forest bathing all of the time. That's absolutely a common practice. And a lot parts of Asia, they will have dedicated forests that are for healing and for health benefits. And they promote those and educate individuals on how to use them and how to incorporate them. And you see a lot of great health benefits from that. But we should do that. We can do that.
Yes, we should do that. This is why I love you, because you don't sit behind and complain. We're trailing behind as a country, but we're moving.
Yeah.
We're going in the right direction. Instead of sitting in the back and complaining, oh, there's no help in Ohio or in the US, we don't have access to this. How about we create it?
Yes.
How about we do something about it? So small, consistent steps in the direction of our health goals.
Yeah.
This is why I just I love you so much, in case you can't tell. But I'm just, so bring me back to my children. Okay.
Yes.
So I really, really want us to prioritize children when we talk about all this nature stuff. I know you have 3 babies.
Yes.
Okay. So what is one thing that Dr. Gorka, with the research, the clinical aptitude, and all the knowledge and all this study, what are you doing at home with your children? One little thing that I can do with my own 3 children at home that can improve us spending time outside.
Yes.
Yes.
One is I talk to them about nature. I really want them to appreciate nature. We as a society are very at risk of basically running out of people who care about green space. As we've gone so indoors, we need a future of environmentalists, of people who protect green space. So I talk to my kids a lot about respecting nature and the benefits of it, and striving for it. And they are young, they absorb things. They
Your babies are very young.
Yes, they are very young.
So they're blessed to be listening to this at a very young and tender age.
Yes. Every night before bed, we all sit outside for 15 minutes as a way for relaxation, transitioning into the bedtime routine. And we just observe, I'd say, point out something that you see. And they're like, over there is a bird, or I see this cloud. And we really just spend time with all 5 of our senses, sitting outside.
Just 15 minutes.
Yeah, kids love bedtime routines. I mean, at least young kids like
they
mine.
do.
So it just has become part of the routine. And, we can sit on the porch if it's raining and just find ways to make that part of our everyday. But then Ohio has really great parks.
Yes.
They're kind of hidden behind signs, and you have to make an effort to get to them.
But we know them. We know them. So your kids are younger than 10 years. All your kids are less than 10.
Yeah.
Okay, so I'm in the teenage. I have 11, I have 15, and 16, 17.
Yep.
So this is what I do. We are going to a park every time, and we rotate who picks the park.
Yeah.
So they already know a lot of the parks. Yeah. So we do Antrim Park, or we do Concord, or we do Liberty, or we do High Banks, So you pick which one, and then we drive over there, and then we park, and we just go around the loop. And I just pretend to be lost all the time, and I let my little one guide us. So we
Yes.
go to on the park where they go, you are here, and if you go this loop, and he's always trying to choose the shorter route around.
Yeah.
And so we do the shorter route, and he's like, oh, where's the shortest way to the car right now? So,
Yeah.
but at least we're out there. And the goal is to spend 30 minutes to an hour out there. The past week, we really didn't do much because it was really hot. We tried to go out really early.
Yeah.
But this week has been fun, and we've gone out.
Yeah.
And sometimes we go out and it rains.
Yeah.
And we made it so much fun
Yeah.
in the rain, and we came back, and all we had to do is clean dirty shoes.
Yeah.
Some of the
dance in
shoes,
the rain.
it was so fun.
Yeah.
But so this is the thing with teenagers, and we went out there, and the only person who was allowed to have her phone was me.
Okay.
Yeah, because I have to take pictures because I wanted to post some of them on social media.
Yeah.
So, but all the phones stayed at home, and we take one phone
Yes.
just in case we need it.
Yes. I think that's so important. The idea, I think a lot of us tell our kids, put down the screens. It's bad for you. Put down the
Yes.
phones. But what are they gonna do instead, right?
Yes.
Sometimes we need a replacement or something else to come in there and at least compete with the screen time.
Yes.
And I do think, sometimes my kids will grumble, oh, I don't feel like it. But every time they're
Yes.
there, they find something that captures their
They start
attention.
doing-
They walk into the creek, or they find
Rock
a frog.
skipping. They started
or-
skipping rocks and they were
Exactly.
trying to see who's is gonna go farthest.
Yes.
And I was like, oh, who knew?
Yeah.
This was fun. You know,
Yeah.
and this goes to me too, because I find myself, and my children would turn around and tell me, they're like, Mom, you said no phones.
Uh-huh.
And I'm on my phone working.
Uh-huh. Yeah.
So as adults, how do we change
We model.
for our, how do we model for
We
our
have
children?
to model that behavior of intentionally putting it away, even saying out loud, I'm putting this away now. I'm going to engage in X, Y, and Z. And by demonstrating that, I think that also goes a long way of like, all right, she put it down.
Mhm.
They will get that message implicitly, explicitly of
This is so lovely, because the thing we said that I'm putting my phone away because I'm like, and then I have to work. What if I get a call? What if, I have to do this? But I said, you know what? One way to regulate myself is we're taking Mala's phone.
uh-huh.
So that's the phone we have in case we need to reach out to somebody or something.
Right.
So my phone stays at home.
Yes.
That way there's no work calls and there's no email reading
Yeah.
as
That's
we go
great.
out. So
Yeah.
we take Mala's phone, because if we're taking pictures of ourselves, we love to take pictures of ourselves in the woods. So, we take Mala's phone, and that's my own way of putting my own guardrail to myself.
That's a great
Yeah.
strategy.
And I love what you're doing. You're doing a multidisciplinary approach
Yes.
towards, so it's not just like only the primary care, or only you're looking at all the different
Yeah.
healthcare providers. What can we do together
Yes.
to improve nature?
Right. I think we could do a lot in our state, in our communities.
Yes.
And what I think is really exciting and fun as a person who loves to do a lot of things at one time, is that nature, I mean, if we really want to do this, if we really want to help build resilience, lower stress, help with the loneliness in our state, I mean, we got to engage schools, communities, urban planners, healthcare systems. I mean, all of us have a role to play in this of bringing us back outdoors and just increasing contact with nature. So I think from all aspects of where we sit, there is something that we could do to push this forward. And with the listeners, I mean, please email me. I am really trying to think through big, bold ideas and strategies that we can bring to our healthcare systems, to our state.
I love
to do
that.
it.
Dr. Gorka just, I was going to give you a different assignment, but she gave you another assignment. So guess what? You're having 2 assignments today. So she said, email her. Dr. Gorka's email is going to be in the show notes. Send her your idea about how can we improve the use of nature to benefit our health, to improve our health. How can we use nature to choose our health? This is not revolutionary. This is not something new. We all know that nature is important for our health. But what are the practical strategies, action items that we could choose as a pharmacist, as a clinician, as a professor, as a mom, as just somebody in the community, as just an Ohioan? What could we do? If we get this right, what do you think Ohio is going to look like in 5 years? Like if we get this right, like just a little difference. What are you imagining? Like,
I think that we could just do something great here in this state and really set the stage for other states to notice. There are places of the US that are doing initiatives around this. I mean, Seattle, right? Washington has such great nature, and they have nature and health centers.
I'm not jealous at all.
California, I mean, they're further along than we are, but for a state like Ohio to stand up and lean into something like this, oh man, I think, think about West Virginia, Kentucky, other states that are close by in our area that also have like great nature.
Yes.
And how many people could be touched and just have these tools to help, I think would be great. Right now, there's almost, if you look at TikTok and things like that, I think millennials are almost nostalgic for their childhood. Like, oh, when I was a kid, my parents would kick me outside and I wouldn't come home until dinner. But now my kids just sit indoors in the air conditioning all day. And like, I hear a lot of my neighbors sort of grumbling about this. So me being the passionate person about this that I am, I was like, let's make a pact. How about all of us agree to kick our kids outside and we'll
so they
push
can go,
them all out into the neighborhood and then they'll,
get
play
out
with
and
each
play.
other. They'll figure it out and we'll sort of recreate
Have you done that?
aspects
Did
of
you
the
do that?
Yes, we've been doing that, and it
And
is
so they're creating friends.
amazing.
They'll find friends,
Yes.
When
there's other people out there, they'll stay out. But if it's
Yes.
just them, they'll beg to come back in.
That's nice.
I think just something so small like that, we can really create changes just within our own.
I love
this isn't my street, right?
I love that.
Just a couple of neighbors.
That makes so much sense.
Yeah.
Dr. Gorka, I want to thank you so much for making the time to spend with me today on Intentional Living with Emlah podcast. And if there's somebody in your life that you care about their mental health, take them on a walk.
Yes.
Take them on a walk. It has been like, I say it all the time, there's so much more to health than prescriptions, and today's conversation is such a beautiful and practical reminder of that. And maybe we don't need to add more. Maybe we don't need to buy something else.
Right.
Maybe we just need to call a friend.
Yeah.
Tell a friend, say, hey, Stephanie, can we go out? Can we go walk? What park do you want to go?
Yeah.
You pick the park today, or we could just walk in the neighborhood.
Yes.
There are trees in the neighborhood. They're outside. We don't even have to get into the car to go to the park.
Right.
Yes. Because that study said that the people in the hospital room that were just facing the green area had better immune systems and healed better. How fascinating is that? So friends, get outside, take a walk, sit by the water, put your toes in the water.
Yeah.
Put your phone down for a minute.
Yeah.
Go for 30 minutes without your phone.
Yeah.
It's going to be okay.
Yeah.
I'm actually talking to myself right now because it took me, it was very difficult for me to go to the park for 30 minutes without my phone.
Yeah.
It was very difficult for me to do that. And yes, I'm talking to myself. So, but this, I'm also talking to you, friends. So keep living with intention, choosing gratitude, and choosing to prioritize your health. Thank you for coming on, Dr. Gorka.
Thank you.
Thank you. Share this episode with all the people, Apple, Spotify, and YouTube. Thank you very much, and continue to live with gratitude and intention.